Hi everyone, and welcome to NETIC's June webinar on recommitting to body image in a COVID-19 classroom. My name is Ari Maharaj. I'm a registered psychotherapist qualifying member in Ontario, and I'm NETIC's Outreach and Education Coordinator. This webinar might be coming to you at very different times depending on when you're watching it, as we're making this recording available. And know that especially with this webinar, the information contained might change compared to the best practices of latest evidence and other things that might come up when talking about something as malleable and flexible as COVID-19. That being said, especially for those in our K-12 education system, teachers, educators, administrators, this webinar is for you, and thank you for joining. Wanted to start by acknowledging COVID, and I think we've been hearing a lot on how this going back to normal, and I kind of wanted to challenge everyone to think about that. I don't know if that'll ever happen, and I don't know if, especially for people from some communities, if we ever want that to happen. The field of eating disorders especially is historically and chronically very white, and this means that Black people and other people of color, the same groups who were disproportionately impacted by COVID-19 in addition to police brutality, are both less likely to receive appropriate care from professionals who understand the ways in which race, identity, and health intersect. And health, as we know it, is correlated with many factors, and the experience of racism and intergenerational trauma, including police brutality, can have powerfully negative impacts on health. NETIC's organizational mission involves supporting individuals in achieving health, whatever that might be. And we must consider the social factors which can deny individuals' health rather than just looking at it as an individual issue. Most of even what we consider as evidence-based practice is based on research mainly done on young college-aged white folks, primarily from the northeastern United States, including the seminal studies on BMI. Even discussions we have on cultural competency in our institutions and in our organizations bring up questions about competency for whom, thinking that if we just studied people's experiences and had a couple hours of training, the thoughts and feelings and behaviors that we might have that are steeped in racism and supremacy would just disappear. We often hear, and you'll hear throughout this, the all bodies are good bodies phrase, and we firmly believe that's true. And at the same time, we know that beauty ideals are rooted in white supremacy and impact whose bodies are perceived as good and whose body is perceived as a threat. Body positivity exists because of activists, many of whom who are fat Black women. And Pride Month, when this webinar was initially held in June, is because of riots started by trans people of color like Marsha P. Johnson and Sylvia Rivera. And all of the things we talk about today, from recognition and responding and referring and strategies, we also need to commit to reflection and lifelong learning about how these issues impact our students in our schools. Here's what we're going to be focused on today. We're going to set a little bit of the scene and then focus on how COVID-19 has impacted people with eating disorders. We'll talk a bit about what eating disorder prevention looks like and what it can look like, provide some strategies and classroom tools for all of you in these situations, and end with some reflections and resources. Also wanted to do a really important acknowledgement for many of the educators watching that it's weird to say because of course you're human and of course you're people, but I kind of think in the way in which we've been having this return to school conversations, it almost seems like a giant experiment, and this isn't really an experiment when lives are at stake, and you all have lives and families who you want to protect too. We also can't really separate out the economy and the lives of the people supporting it, and I thought it was important for us to do that acknowledgement at the beginning. So let's get into it. Let's start with recognizing what is an eating disorder, and this is the definition that we use currently at NETIC. There are a couple key things in here. It's a persistent disturbance in eating and eating-related behaviors that negatively impact one's physical health, mental health, and/or psychosocial functioning. All of these components, so it's a really complex kind of phenomenon. And instead of looking at it definitionally, we often ask folks to look at it across this continuum. So if we have on the very left some of the things that we strive to hopefully have in every human: body acceptance, a trust in your body, being flexible around food. Have on our very right some of the things that are worrying, like a diagnosed eating disorder on the very right, but also some of these words here that I often think of as flags. The more flags that a student has or a person has, the more likely they are to be shifting a bit to the right, and the more worried I would be. Again, we can often see a lot of these flags as somewhat of coping mechanisms that come up for people, especially in times of stress. Things like restricting, things like compulsive eating or excessive exercise. I'm sure many of you watching have students who are perfectionists, who self-describe themselves that way and see it as a really wonderful thing for their ambition. And it can be, but when that perfectionism is applied to our body and to the way in which we eat, sometimes that can cause us to really engage in rigid patterns of behavior and things that could potentially cause harm to our bodies. And that's the way in which we talk about it as a disordered eating behavior. Instead of having me drone on about it, we thought it's really important that you learn from lived experience itself. So here's a video.
Heaven forbid a man deals with something that a woman does. You know, this idea that like, if it's a woman's disease, you're not as much of a man for having it. There were many different steps that turned what were smaller, unhealthier behaviors into something that was out of control. I think this is common for people with eating disorders, is one day they might have the realization that, yeah, this is an eating disorder, but generally at that point, they've probably had it for quite a while. My earliest memories of what I would consider to be disordered eating, disordered body image, started probably as early as middle school. Looking back, I would say what I was doing was a lot of chronic dieting. It was in university that sort of spiraled into exercise compulsion, and from there, some behaviors that I think people would associate with anorexia, a lot of periods of starvation, and then more behaviors that people would associate with bulimia, so a lot of binging and purging, calorie counting, being obsessive of tracking my food, all that sort of thing. When I physically started to make myself purge, that was when I knew it had for sure crossed a line into something that was unhealthy. Before, I think I could sort of kid myself that the excessive exercise was healthy, even though I didn't enjoy it. When you're actually making yourself purge, I think it's sort of hard to kid yourself that there's something health-related about that. For me, I think it was a mental health issue. It's not actually about the food. It was an intense fear, an intense anxiety, where I felt like the only thing I could do to make that intense anxiety go away was to get rid of it. People assume that, specifically that anorexia is a white teenage girl's problem. They don't realize that body image, eating disorder issues, that there's all different kinds of them, and that it doesn't matter your race, nationality, gender identification, sexuality, none of those things really matter. The other men that I've met who were seeking out help, I remember like repetitive themes of them feeling like when they talked about it to other people, that it wasn't really recognized. Even in school for health and fitness, if one of the female athletes that was in my program had dropped the amount of weight that I did, I think it probably would have been addressed in that way a lot more and a lot quicker. I think more than anything, Sheena's place normalized my experience. It was like, hey, man, you're not the only person who deals with these issues. You're not the only guy. What I've said to people who I've worked with who struggle with eating disorder behaviors is try to imagine a life where body image, food, exercise, where those things aren't a problem for you. Where if these things weren't consuming what you were doing, what you might do with that life. That was my motivation for getting better. But there were many days when I was actively pursuing recovery, whatever you want to call it, where where I struggled. It felt difficult, and I felt like, okay, I've made these strides. I'm not doing these select behaviors anymore, but I'm still dealing with this anxiety. Like, am I ever going to be able to just exercise or just eat a meal without it being an issue? And I would say that probably lasted for a good, at least a year after I started getting help. I would still have those periods of fear that it wouldn't go away, but it did. I think it does. I think at some point you can make the choice to say, I'm worth getting some help for, like my life is worth pursuing help, deciding to try to get better, but it's not as easy as just saying, screw it, I'm gonna eat dinner. There was a lot of goal setting and there was a lot of failing at those goals, but the biggest thing is not beating yourself up. I think that just throws you back further.
So as Jay talked about in the video, a lot of really important points, both the way in which someone may get impacted by an eating disorder, the fact that they can affect many people regardless of different social identity categories, and also the way in which help seeking worked for his story and the way it might work for other folks. I think especially for COVID-19 in this new world, there are a couple of signs that we've noticed anecdotally that might be a little bit more worrying, and things that you might want to recognize as people trying to support other humans. So here are some common behavioral warning signs, and the bold ones are the ones that we think are especially, I think, a little bit more flaggy right now with COVID. Restricting foods from one's diet, whether it's someone impacted by food insecurity or someone having less food available because grocery shopping is more of an issue going outside. That's something we're extra worried about. Following strict food rules, so the extent of that and how much that might impact someone when they might need to just eat whatever's around but have a hard time doing it. That weight piece or the control around food is determining how the person feels about themselves. Following a really strict exercise regimen. On our national toll-free helpline, we heard so many comments and concerns, especially in April and May, where people weren't able to exercise in the way that they would usually because of some of the distancing requirements outside and how much that impacted their life. While physical activity is wonderful, and we'll talk about it later, it can also be a worry if you can't go without it, or you're exercising through pain, or like that's your sole coping mechanism. And that strictness is part of the worry. And then that withdrawing from social activities. To some extent, this happened for almost all of us. And for some people have been able to adapt in new ways to have social activity, and other folks have just completely crawled into a hole, and that's sometimes really hard to get out of. And I think that's the worrying sign here. And then finally, especially with the pandemic, and we'll talk about this in a sec, weight loss or weight gain especially is something that's a bit more normal. Like your body might have already engaged in survival mechanisms and wanting to put on more weight, and that might be a trigger. And then someone experiencing dizziness or fainting, whether it's because of activity, whether it's because of food intake, those are all physical warning signs that we'd be worried about, especially during this time. So let's talk about how the pandemic has affected eating disorder risk. And this is from a 2020 study from Rogers et al. And we're gonna go through all of these different risk components. So whether it's media exposure, disruption of daily activities, isolation, modified physical activity and sleep, or negative affect, combined with that how much harder it is for folks to access care and to regulate their emotions and access treatment. Combined, that's a really worrying sign for both eating disorder risk or for symptoms for those who are currently already impacted. So let's start with media exposure. This is one that I think, especially in the early months, was worrying. And a lot of the 10, 11, 12, 13-year-olds we chatted with on the helpline were bringing up how many body-related images they were seeing on Instagram and TikTok, how many like home workout routines or home cooking. There was that whole bread phenomenon, just how much of the visual of like food and exercise, how much that potentially impacted them, and some harmful messaging too. So some folks saw the COVID-19 as a play on words alluding to the freshman 15 that we sometimes see in post-secondary. Those recipes in home cooking and the way people were saying like what is good food and what is bad food, and that strictness around the rules were really impacting people. And then even what we're doing right now in some sort of way, like video conferencing, or many of you might be doing in work or school settings, is kind of like looking in the mirror all the time. And that's something that is A, different for many folks, and B, can be jarring, especially if you might not like what you're seeing in that mirror. So in school settings, I say to like lean into this, integrate media literacy programming into your classroom. Make sure you're actually bringing these things up and discussing them with your students. Ensure that the weight science literature is reflected in health and phys ed. So making sure that students know, especially them going through puberty, that like weight gain is a really normal part of development. That's a really good thing to know. And if you're using things like Zoom or Microsoft Teams or Google Classroom and you're video conferencing, see if there's a hide self-view option. I know on Zoom there is. If you hit the little 3 dots and you can hide self-view, it's just a way to really help people not necessarily have to have that pressure on themselves all the time, and they can actually engage in the learning that they're hopefully there for. Establishing a routine. So this is something that's really, really difficult. And I think especially in our hybrid classrooms or our modified in-person classrooms or full virtual classrooms, that routine is almost thrown out. It's we're blending home and work, we're blending distancing and learning, we're blending social groups. And that can increase the risk of many troublesome behaviors, but including eating disorder behaviors, because sometimes we might be removing structures that were there and we're supporting regular eating times. So whether that's snacks on recess, whether that's a normal like long-ish lunch break, whether that's like your breakfast and your dinner after or around school, if you're at home and that home school work blend is happening, that's all really, really difficult. So our recommendation is whatever the plan is when you return to teaching, or return to homeschooling, sticking to a routine wherever possible is so important for people, students, teachers, and parents alike, to stay grounded. Finding some sort of routine in whatever your normal is going to be is so key of making sure you're getting hydrated, you're getting movement, and you're getting food intake. Emotional eating. I think this is something that you might see. I think we all sort of engage in emotional eating at times, whether that's rewarding yourself with food or eating more when you're stressed, like this image sort of says. Food really tastes good and can bring joy and comfort. And here are some signs that we have on the slide of when you might be engaging in emotional eating, some of the things that are there. I think with this one especially, acknowledging that eating when you're stressed is a really practical coping mechanism is something that's important. And whether you're at home or in school and having conversations with people, having an open conversation about the other ways to manage these stressors while acknowledging what your body is telling you with kindness, that I am stressed and I am hurt and I want comfort. Those are all really important things to make people feel like they're heard and diversify those coping mechanisms so it's not just reliant on food, or if food is the first one, maybe bump it down the list so it's in the top 10, but maybe not your first. And that brings us to how are you actually talking about food? Often the emotional eating conversation can turn harmful because we're using very judgy or negative or emotion-laden or value-laden words around food. NEDIC uses fuel food and fun food because it thinks it gets us to the function of what the words are actually supposed to mean, of healthy and unhealthy instead. Fuel food gives us energy we need to function, and fun food adds enjoyment to our lives. Another example is always food and sometimes food. So again, not value laden or not meant to be emotional, like getting at the function of what that food is. This isn't also a dichotomy. So we know that fuel fun foods exist too, whether that's like chocolate bananas or fruit-based ice cream or whatever it might be. Having a blend of foods is something that is important for every person. And ideally, you're having more fuel foods than fun foods, but fun foods are okay too. Weekends, birthdays, special occasions, especially in a lot of like cultural celebrations and holidays, food is such an essential part of that. And we don't want to lose that fun and that enjoyment while still trying to nourish our body with the fuel that it needs to function. And especially in these times, there may be many people who are struggling to even obtain and secure food. Food insecurity is something that has impacted 1.1 million Canadians before the pandemic. And in April 2020, right when the pandemic hit, Food Banks Canada reported that that number was up 20%. And we know from really clear research from Carolyn Becker and colleagues that people with the highest level of food insecurity also endorse significantly higher levels of binge eating, distress around eating, that emotional eating, dietary restraint. They're also stigmatizing of their own weight. And they also have a lot of anxiety, a lot of worry, which obviously makes sense when food is one of the basic things we need. So that might be something that is impacting folks in your setting. This also, when your body doesn't necessarily have a reliable indicator of when it's going to be getting food, our hunger cues, the natural biological cues that we're born with, are a mess. They're all over the place. And restriction might not just happen because of people being like, well, they want to lose weight and that's why it's happening. It's because their body is just having no idea of when it's getting food. So weight might be just fluctuating because of that. Many children especially have so little autonomy over their food choices. So when we're in classrooms and we're seeing maybe not very good quality food or little food, be really wary about food shaming and passing judgments because we don't really know what's up in that environment. And instead, when you're compiling resources like the many mental health resources you all might be already compiling, check with your school or your school board to consider having a list of nearby food banks accessible, because that way there's an easy access to communicating that information to parents and families and students themselves so they can get food if they're in a food insecure environment. Physical activity and well-being. We touched on this a little bit with the TikTok and Instagram section. And again, I think it's really important that I say that we love physical activity. It's something for movement and for joy and something all humans do in whatever way, shape, or form that they might do it. What we have an issue with is when fitness messages are perceived as representation of one's character or willpower, and when it's used to really craft or shape a body in a certain way, especially for a young person, because that often turns them to harmful practices like dieting, a giant risk factor for eating disorders, excessive exercise, and potentially substance use, as youth try to maybe overcome the feelings of inadequacy that they might have about not having that body or not being able to engage in that level of activity as their peers, or trying to fit in that way. Exercise especially can often be used to help people feel in control and accepted by others. And especially when we saw this pre-pandemic and during the pandemic, the people who were doing their home exercising, or the people who did have a certain kind of body, this like lean muscular ideal, they're complimented for it. It's something that's societally acceptable. So it can be really, really difficult when someone's excessively exercising to get them to see that something might be up because they're being validated for it. It's serving a purpose. Physical activity especially is in health and phys ed and curriculum-based work, and especially in some of the socio-emotional learning work that we do. And we really encourage you think about framing physical activity from a pleasure and health benefit kind of way, rather than following a specific routine of regimented exercise or for the purpose of weight loss or weight management, especially for young people. We ask you to consider whether your health and phys ed curriculum is eating disorder informed. If you're worried about how to adapt your messages, get in touch with us, and I'll leave our contact information at the end of the webinar, so that way we can talk to you about that, because maybe there's some adjustments that we can make. Also, if health and phys ed is being reduced because of the potential nature of your remote work or because of distancing requirements in your board or your environment, think about other physical coping strategies that we can maybe offer children that teach physical activity from a well-being perspective, even if might not be doing the sport-based activity that we're used to. Here are some other coping strategies that we often suggest to folks on our helpline, with some links there for you, whether that's mindfulness, grounding, especially if you're in distress in a moment, ways to take a breath break, walking around to get some fresh air and put a mask on and walk around your neighborhood, drawing or journaling, or maybe even disconnecting when you're mindlessly scrolling. You can sort of feel out of touch with yourself, and especially for youth, making sure that they're disconnecting, and even for all of you, making sure that you're disconnecting. This is going to be an hour-long webinar, and you might need to take a walk or move around afterwards. So let's switch gears and talk about what eating disorder prevention looks like. And to do that, let's think about the causes of an eating disorder. A lot of people have questions about what the causes are, and really the answer is there's no one cause. It's often a perfect storm of genetic vulnerability, that biological piece, psychological vulnerability, whether that's perfectionism or predisposed to black or white thinking, those sorts of things. And then social vulnerability, which to some extent we all have growing up in Western environments with Western media ideals and exposure to the kind of images that we see online or in person, and potentially even exposure to weight-based discrimination that might happen for some folks. All three of these things together often combine to cause an eating disorder. So it's a really complicated mess sometimes to try to disentangle. When we talk a lot about body image, like in the title of this webinar, it really fits into that sociocultural piece. And that's often the piece that we have most control over. It's really hard to control over your genetics or even some of the psychological risk. But the way in which we act as parents or peers or teachers or role model, and the type of media that we display to our young folks, those are sociocultural things that we can influence. And ideally, we're trying to limit social comparison and limit that internalization of a media ideal that can be really damaging, that says that one body is the body that we should all be striving for. Because ultimately, we're trying to prevent body dissatisfaction from happening. We're trying to increase that body trust instead. There are two main types of prevention, and this is generally across mental health in general. The example that I have in here is around bullying prevention, for example. There's universal prevention, which is the type that targets all students, and we're aiming to promote healthy development. We're trying to understand some of the issues and trying to stop issues before they begin. And then there's targeted prevention, which is really targeted to those who are beginning to already show the indications of being someone who's affected. And here we're more so trying to stop the development of it becoming more serious. We're going to start with focusing on that universal piece. And what I really implore all of you to do is to take a whole school approach to eating disorder prevention in a universal perspective. There are some policy suggestions that are here, including a statement in the school mission, ensuring no weighing of students in any context to really not emphasize that weight is an indicator of health, providing an opportunity for all students to engage in regular physical activity in a non-competitive, safe, secure way. If you're back in person, providing a balance of food options from all food groups in the dining hall in a way that's in accordance with something like the Canada Food Guide. Display public material that includes a wide diversity of body shapes and sizes and ethnicities. Really embrace that size diversity piece when we talk about diversity too. In your curriculum, you can work to integrate body image work into the curriculum in an age-appropriate manner. In biology, talking about diet and exercise. talking about puberty and health and phys ed, like we talked about earlier, talking about body image awareness and media literacy education in English and the arts. We're talking about the different societies and cultures, the way they looked at food, the way they looked at body image, the way they looked at what healthy was in something like history or geography. Indigenous conceptions of bodies are often so different and so tied to land as opposed to our Western kind of ideals and the Eurocentric curriculum that we might have. And that might be a really cool way to do some of that history and geography work to folks across this country. And then engaging parents. It's really hard as a teacher, which I'm sure you know, to provide one sort of message and then send a student home and they get a different kind of message. And especially when everyone has an opinion on food, weight, and shape, making up-to-date information available for parents to support their child is something that's so key. And I think especially in this time, something that parents are really looking for. We've often gone out and done parent talks or informational nights around eating disorder issues for parents, and that's something we're happy to do. One thing that's also really important here is before we actually think about doing anything, we really have to consider that prevention starts with us. And we really have to consider some of our own beliefs and conceptions that we might have around food, weight, shape, because we might accidentally be contributing to a student or a loved one's own thoughts and feelings about themselves. Here are some key myths that we've heard of often, that a high weight is largely the result of poor self-control or weak willpower, when in fact it's actually largely genetic. Height and weight are often combined together, and we have such a good understanding in society about height being very genetic, but for weight, we think we can control a lot of it, when really I think the science is clear on how we have a range for our weights, just like we have a range for our height. And maybe there are some things we can do to be at the top end of that range or the bottom end of that range. And maybe temporarily we can be at the low or high end of that range. But for most of your life, you're really going to be within that range. And that's something that's often genetically set. We have a myth that weight is a key driver of health outcomes. But in reality, our metabolic syndrome is more important, what's going on biologically. And that's something our eyes can't really see. They play tricks on us. And in fact, if one of the lessons from this pandemic can be something powerful, it's that your social determinants to health, your access to good medical care, your access to green space, to housing, to food, contribute far more to health outcomes than your weight ever does. There's also a myth that people who are overweight need to go to the doctor, when people in higher weight bodies might actually be avoiding the doctor because they have a negative experience. And healthcare providers are often a really giant source of weight stigma, and a lot of work needs to be done for us to unlearn and relearn the way in which we're having conversations with people around this. As we turn our attention now to targeted prevention, one thing that we often talk about with our clients on our helpline are the stages of change. This is a trans-theoretical model of ways to conceptualize where someone might be with a certain kind of issue. It's often used a lot in substance use, but we use it a lot in eating disorders here too, because one of the things that's really normal is for someone who's struggling to not see a problem with their current behavior. They're in this pre-contemplation phase. And that might be really, really hard for a loved one who's seeing all of those warning signs that we were talking about earlier, but now coming in and trying to communicate that, and that person isn't really seeing that. I want you to know that that's really, really normal. Just like how it's really, really normal for relapse to happen in something like an eating disorder, because you're trying to unlearn and relearn your whole way of being often. And where we really start for educators on your role is really just to start the conversation. None of you are therapists or counselors, but you are important role models for people. Whether you're a parent watching this or an educator, you can have an impact. And often it's in this initial conversation piece of identifying yourself as a safe person for someone to really feel like they can come to you. And all that starts with is conveying empathy and not trying to change the person or change that perspective. just care for them. Tell them how you do love them for nothing of what they look like, and to build a relationship and develop trust. You don't want to blame or speculate, and you might find it really tough to listen to what they have to say, especially if you have a really different understanding, but you're really just there being a safe, supportive person for them. If it's appropriate, you can provide some education, like showing this video or talking to them about what you learned today, that eating disorders are common among many people, that there's lots of reasons for them to be feeling ashamed or afraid. And sometimes you can acknowledge their ambivalence. Often it's almost like someone with an eating disorder is like fighting themselves. And you can say things like, it almost sounds like you're battling yourself, or it sounds like something about what you're telling me isn't sitting right with you. Those are really wonderful ways to acknowledge that someone's kind of often stuck in that pre-contemplation to contemplation stage. What you might want to also do too with some of the physical warning signs I was talking about earlier is to do a safety check. As you know, some people might need medical support if they're experiencing things like a blackout or a dizziness or fainting or heart palpitations. And talking to them about what they might need is a lot better than having to take action on behalf of someone. There's also a lot of students that just might be experiencing either negative body image or negative body talk. And one thing that you might do, especially as an educator or an adult in this setting, is to remind them of some of the evidence you learned in this presentation, provided citations there for a reason. Because I think it's often a new thing for folks to learn about this way of thinking about weight, size, and health. It might be really different than what they're seeing in the media or what they're seeing from their friends and family. Reinforce to them that it isn't their fault, that their experience is their experience, and affirm all of their qualities and abilities that are unrelated to food or physical appearance, even while you're listening to them sometimes degrade themselves around what they're experiencing, because you can understand where that might be coming from. In conversation, whether this is like a student conversation by themselves or in the lunchroom or kids between kids or adults between adults, remind them that when it's safe and possible, that they don't have to take the negative things being said about them, whether that's the way that they're thinking about them afterwards, or when they're in conversation, remind them that sometimes if they can, that they have the power to leave that conversation or to redirect the conversation if they feel uncomfortable about their friends talking about different diets or different exercise routines. Often we kind of feel like we have to take it when maybe there are gentle ways we can redirect. For you, finally, to look into the resources available at your school or your environment, whether that's a virtual lunch and learn with us, whether that's talking to a school social worker or a psychologist. You don't have to be in this alone, especially if you're an educator. And when you're considering, when I asked you earlier to think about a whole school approach, you can ask these questions to yourself and to your administrators and to your fellow faculty to talk about what a body inclusive school might look like in your context, some of the barriers to achieving this, and if possible, some of the champions that you can tap into to help, because hopefully you're already one of them. That brings us to us, and especially in this time, we're able virtually to Zoom into classrooms across the country. We often have 1-hour sessions on things like weight stigma, ways to teach media literacy, coping with diet talk, discussing food in classroom, and some curriculum adaptations, especially for K to 8, but including that 9 to 12. We really like to take a whole school approach, which means talking about policies with administrators, doing a workshop with students on some of these risk factors, educating staff, and doing parent sessions for those at home with our parent volunteers in a really engaging evening. You can learn more and book us at that link below. And then finally, we have some curriculum resources for you. Beyond Images is something that's being downloaded more than 20,000 times. It's a free self-esteem and body image curriculum for grades 4 to 8, beyondimages.ca for the English version, and au-delà de l'image.ca for the French version. Reflections of Me is an ETFO body image curriculum that's there. And we really implore that you use these decision support tools in collaboration with your school social worker or your school administrator to determine if these resources are a good fit for you in your classroom. A lot of schools, I think, especially in Canada, often know about the Dove self-esteem curriculum, and those are other ways in which body image work is in our schools. Finally, just for your own learning, here are some books and resources for parents and caregivers or professionals. These ones are about fostering balanced eating in youth, so pause this if you need this. And then these are to help youth who are experiencing an eating disorder, including that Andrew Whalen book at the bottom if it's a boy or someone who identifies as a boy or a man, depending on their age, that they might be struggling. And then finally, here are some resources in terms of websites and apps for you to use. The Ellen Satter Institute is a really wonderful food-based resource, especially. Ellen Satter is a dietitian who does a lot of this work in this area. Recovery Record and Rise Up and Recover are two apps that are alternatives to something like a MyFitnessPal. It's a little bit more eating disorder informed for those folks who might like that work. If you're a parent or a caregiver or a family member, Feast has a helpline themselves and a forum for folks to talk about some of these issues, to really know globally that this is something that there's a community for. And here in Ontario, the folks at the Children's Hospital of Eastern Ontario in Ottawa created a wonderful website called Understanding Eating Disorders in Adolescence. Really wonderful explanation of the causes of eating disorders, what that looks like in a youth, how to spot it, some strategies that you can check out at canped.ca. And then some COVID-specific resources, whether that's the Government of Canada's food safety guidelines, because that's a worry for some folks. Sick Kids here in Toronto has some recommendations for school reopening. There's a Food Banks Canada list of food banks for you to include in your school resources. OFIA, a nonprofit here in Ontario, has a blog on how to reimagine health and physical education during this time. And then nationally, especially for youth, jack.org, School Mental Health Ontario, and Kids Help Phone has an online resource hub that you can access. And then finally, NEDIC services. We have a service provider directory for folks who really are in need of support and care from a therapist or a dietitian or a medical provider. And we have things like patient checklists to really help navigate those really tough conversations. Our helpline has hours that are here. Hours might be changing over the course of COVID, and these are our normal everyday hours. Right now during COVID, the phone line is only available between 11 and 7 to allow for our staff to distance accordingly, but know that our chat is open from 9 a.m. to 9 p.m. on Monday to Thursday and 9 to 5 on Friday. It's anonymous and confidential, and we're happy to provide those conversations that you might be finding it tough to have. So thank you for your time and thank you for tuning in. I hope this webinar was helpful, and please do get in touch if you have any feedback for us. Take care.